you see in the future for orthopedics?
Orthobiologics is definitely it. It's, the combination of the orthopedic side with the biological side. And the biological side being, using things that are natural for a patient and utilizing them to help the patient treat areas that are injured. It seems very basic, but that's where all of the advances I think are going to come over the next 20 years in orthopedics. Cartilage, for example, when you damage your cartilage, the body doesn't have a great natural way to heal that by itself. But if you utilize stem cells from a patient, or maybe the platelets from their blood that have a lot of growth factors and healing factors in there, and you can inject those into areas of cartilage damage, then you can stimulate the body to do its own healing. And I think that's going to be one of the big areas that is going to be developed further in the next 5, 10, 20 years.
And you're already doing that in your own practice now, aren't you? With ACL,
absolutely,
with the ACL reconstruction or preservation,
yes.
rather.
Preservation, absolutely. So we're doing some really neat things. The ACL is a very commonly injured knee ligament. Everybody hears about it on TV with different athletes tearing their ACL. And really the current treatment is to reconstruct it, which means that we take out the torn ACL, we drill holes in the bone, and we put another ligament tendon in there to replace the ACL. Which is additional surgery where we have to take that from the patient's body. And so there is newer technology where we're able to preserve the patient's own ACL. So even when it tears, we can repair it back together. And even though that's something that was tried 30, 40, 50 years ago and didn't do so well, the reason that it's working better now is that we're able to combine it with the biologics so that we can use the patient's stem cells and inject those into the knee, and that helps the torn ACL to heal. The other part of it is that 40 years ago, they would just put you in a cast for about 2 months and let everything tighten up and stiffen up, and you'd have this real stiff knee joint. Well, as our knowledge of rehabilitation has improved, we're employing that with the stem cells and everything, so patients are doing a lot better. And a lot of some preliminary work is showing that patients are doing better than with an ACL reconstruction. So it's a very exciting and promising field.